The central government has shown a tremendous lack of leadership and a lack of vision. That is partly, I think, poor policy making. That is partly genuine constraints on what they can and cannot do. There are mixed messages being sent across the board. On the one hand, in the city of Bombay, you have a lockdown now that's even contemplating whether or not mask wearing should be required in private vehicles. At the same time that the Prime Minister and the Home Minister and the opposition, of course, are hosting huge rallies of thousands, tens of thousands of people, none of whom are wearing masks. This is happening simultaneously to a discussion about lockdowns and night lockdowns. So the notion that the government is speaking with one voice is on its face incorrect. India also just tremendously has underinvested in actual data. The truth of the matter is we have no idea how bad the situation is. Delhi, Punjab, Maharashtra and Kerala are among the highest number of cases. Those are, by any definition, by any indicator, among the best governed states in India. They're also all opposition-controlled states. The notion that Uttar Pradesh, that Bihar, that the northern states of India, which tend to be poorer, less well-governed, don't have similar cases is simply, I think, a fiction, and one that is maintained by very low testing rates that is masking the tremendous issue that is afflicting the country. We do not know actually how many deaths have occurred because the data are simply spotty and unreliable. And the final point just to make for the conversation in terms of the economy, the government has hamstrung itself. It does not have the fiscal capacity to provide the income support that is necessary to go along with any sort of real lockdown measures. Yes, is there fatigue? Of course there is fatigue. But the fact of the matter is that 500 million people require daily wages as a way of survival, and the Indian government does not have the means or the capacity or in fact the will to actually do what it would be required to provide them the support so that they can stay at home and get through what has to be gotten through.
I want to get back to that point.
Yes, is this a difficult problem? It is, but a real failure.
I want to get back to that point about what kind of a stimulus plan, what kind of support from the state for people who are struggling a little bit later on. First, though, Rajat Sethi, do you agree that campaign rallies should be banned?
Well, if you look at the COVID spread across India's various states, you will realize that the states that are going into elections are certainly not the hotspots. Also, if you talk about some of the bigger states like Uttar Pradesh, etc., Uttar Pradesh and Bihar, which have already seen, Bihar was one state which went into elections just recently in the month of October. And there too, there were several election rallies and there wasn't a big spike in the number of cases. So there were data points early on. And let me tell you one more thing. Just a month back, India had really controlled and flattened the COVID curve pretty well. There were less than 100,000 cases across the whole country. And therefore, even the politicians of the day thought that they could go through the election campaigns and conduct these mass rallies. But I think going forward, they will have to be much more careful in terms of ensuring social distancing as well as ensuring other protocols are strictly followed in these state elections. Mind you, most of the state elections, several important phases are already over. There's just one state election which is going to drag on for another 15 odd days. And I'm sure there'll be stricter protocols in those phases of election.